Stroke is the fifth leading cause of death in the United States. On average, someone suffers a stroke every 40 seconds, and about every 4 minutes, someone dies. Dr. Brent Wallis from People's Health joins us this morning to discuss the warning signs and some lifestyle changes to help prevent a stroke. Hi, Dr. Wallis. Good morning.
Good morning. Thanks for having me.
Thanks for joining us. All right, so what exactly is a stroke? What happens inside your body?
Sure. So a stroke, keep in mind, just like all organs in the body, the brain needs blood to function. And so when you have an interruption in that blood flow, that can cause damage to the brain cells. And because the brain really controls all functions in your body, if you damage one section of it, there's going to be a lot of pretty severe consequences.
A lot of different things can happen when you have a stroke. Can you talk about what are some of the effects?
Yeah, we really think of it in terms of three different areas. So motor, sensory, and then function. So on the motor side, if you have a stroke, it actually can affect your ability to walk or move or pick things up. On the sensory side, it can actually cause tingling or numbness, not being able to feel a limb or a side of your body. And then on the function side, it can really affect your thinking, your speaking, and actually even your sight. So it's far-reaching.
Yeah. Is there a certain group of people that's more at risk of having a stroke?
Yeah, definitely. Our older population has a higher risk of stroke, and then men in particular have a higher risk than women. But in particular, people who have chronic medical problems like diabetes or high blood pressure or history of heart disease really have a significant increased risk. And then smoking is a huge risk for all types of vascular disease, so it can definitely lead to stroke.
Are there warning signs? I mean, does this just kind of happen out of the blue?
Yeah, unfortunately, the majority of the time, strokes are very sudden, and there's not really a warning that it's coming on, which is why it's so important to keep your other diseases under control. But occasionally, in about 15% of cases, it may be preceded by something called a TIA, or a transient ischemic attack. And that's when you get a little decreased blood flow to your brain, and it may cause some temporary symptoms that can mimic a stroke, but they go away. So if you've ever had an episode like that, it's something you absolutely have to speak to your doctor about.
And I know it's imperative to call 911 even if you think you have, one of these symptoms.
Yeah, definitely. We're very attuned to calling 911 if we're having chest pain and we think it's a heart attack. Well, stroke, you should think about like a brain attack. It's just as critical. Time is brain. And so if you're having these issues, you really need to call 911 right away.
All right, Dr. Wallis, thank you very much for the information this morning. Thanks for joining us.
Thanks, Meg. Have a great weekend.